Would you mind introducing yourself to our audience?
Yeah, hi, I'm DJ Lakkireddy. I'm a cardiac electrophysiologist from the Kansas City Heart Rhythm Institute, Kansas City.
I understand that you have a very interesting background where you are studying dysautonomia in the context of electrophysiology. How did you develop this interest?
I think the autonomic nervous system is the most fascinating part of the human body. Having born and brought up in India and a close connection to yogic principles of life, explanations of the human body functioning as it is described by our predecessors many centuries ago beautifully fits the current model of the sympathetic, parasympathetic, the sort of all-encompassing autonomic nervous system control over the human body. So when you look at the Patanjali's yogic flow of energy to the Netter's anatomy of the autonomic nervous system of the human body, with the vortices of energy and the flow of energy into the afferent efferent systems, you have a very similar concept that is now the current day anatomists and physiologists have really come up with. In principle, I think autonomic nervous system really plays a very vital role in every facet of the human functioning. And that's the reason why it always fascinated me.
I think that is such a deep and insightful way of thinking about something that is not taught in traditional medicine. So how have you integrated this understanding into your clinical practice as an electrophysiologist? Why does it matter?
The first model we studied was atrial fibrillation, right? So in our Yoga My Heart study, which was essentially a small randomized controlled trial where we used yogic principles, prescriptive yoga, implemented in the half of the cohort, and the other half followed their usual exercise regimen. We were able to show that the prescriptive yoga, 30 minutes a day, every day, over a period of 3 to 6 months, can actually decrease the number of episodes of paroxysms of atrial fibrillation. So how exactly does it work, right? It works. And the way it works is the following. When somebody develops atrial fibrillation, there is a significant change in the autonomic tone of the human body. Just before an episode of paroxysmal atrial fibrillation happens, you have a dramatic surge in the sympathetic tone in the body with a sudden withdrawal of the parasympathetic tone, creating a significant amount of vulnerability in the autonomic tone that in turn controls the ability of the cells to fire, right? This instability is what brings in the ectopic beats or these triggers that initiate the arrhythmia. Those triggers in normal patients may not do anything, right? But those people who have underlying risk factors, obesity, HFpEF, hypertension, right? The whole 9 yards of that, where the cardiac tissue is more vulnerable, these triggers get in and then they perpetuate atrial fibrillation that go on and on and on and really becoming an endless loop of arrhythmia. So what yoga does is it decreases the sympathetic tone and it teaches your body to automatically prevent these extreme excursions of autonomic variations and improve the plasticity of the sympathetic parasympathetic tones. And thereby, it mitigates the opportunity to create those ectopic beats and subsequently help the minimizing the number of episodes of atrial fibrillation. So I think yoga fits.
This is brilliant. And mechanistically, it makes sense. You've shown clinically that it's actually a proven therapy for people with AFib. I do have a question about other somatic practices like breathwork. Do you think that there's a role in regulating the nervous system and creating a reduction in the AFib burden in that context?
Absolutely. I mean, if you really think about it, right? So most of the cardiovascular autonomics, they reside in the chest. Anything that you do by breathworks, right, which is, I mean, the principles of pranayama really make a lot of sense because you're exercising your autonomic network, your afferent and efferents, and you're improving their ability to adapt and you're improving the plasticity of your autonomic nervous system. Any cardiovascular dysautonomic phenomena, whether it is vasospastic angina or whether it is PVCs or for that matter, your whole realm of inappropriate sinus tachycardia, vasovagal syncope and POTS, I think that's a phenomenal opportunity for us to really leverage breathing exercises, pranayama, and the work that the breathwork people are actually doing right now could be juxtaposed and incorporated into our management strategies for our patients.
I am just so fascinated by all of these concepts. I'm interventional trained. And as I started seeing patients in clinical practice, I ran into a lot of these patients with dysautonomia, POTS, other kind of systemic issues where we have very little in terms of what's written in the guidelines, but we know that there are a lot of other therapies that can potentially help. And so how do you think we'll get more data in this space, specifically in these patient populations, so that it becomes a wider use practice?
I think the mainstream medical people should not discount these traditional forms of therapy, or I would say this is actually a way of life, right? I mean, if you really look at the Eastern medicine, whether it's yoga or whether it's Tai Chi or any other form of traditional biofeedback, mind body regulatory exercises, have often been sort of looked down upon by Western medicine in many ways. I think now is the time for us to really change that, embrace these, and then study them scientifically, like the way we did our atrial fibrillation study. So we actually have published a lot more data on vasovagal syncope. We published data on inappropriate sinus tachycardia as well as POTS. So why not really come up with some excellent designs for studies and put these concepts to work? And it costs you nothing, right? There are no side effects, right? There are no disasters coming out of these therapies, and it's free, and you can do it at your own will.
So this is music to my ears because I've been exploring this space for the last 2 years. It is such an honor to meet you. I have so many more questions for you. Just the energetics of the body, just all of the different things that go into these Eastern plus synergistically the Western medicine. And so I'm hoping that you'll be willing to do this with us again soon.
Absolutely. Pleasure is mine. Thank you very much.
Thank you.